You're seeking a more accurate and less invasive gastroscopy. Over the past 30 years, gastroscopy has recorded no innovations, and it still depends on visual inspection and on biopsies. But now you have endofaster, an innovative device that analyzes gastric juice in real time during a gastroscopy. Endofaster is integrated into the endoscope by connecting it to the suction system. You become an explorer when you perform an examination. You have to discover the patient's problems, but the stomach does not present evident macroscopic differences very often. Endofaster provides an accurate and instant diagnosis of Helicobacter pylori for all patients. It flags patients at risk who require further histological examinations and indicates those for whom a quick examination will suffice. This additional information might suggest new ideas, which you can evaluate against the visual inspection and case history. Endofaster provides an accurate diagnosis of Helicobacter pylori in 60 seconds by performing a urease test on gastric juice. This procedure does not require biopsies, and the diagnosis is not affected either by the focal nature of the infection or by the intake of PPIs. The analysis will alert you of neoplastic risk factors in real time by running an instant pH test. Elevated gastric pH levels are closely associated with the presence of preneoplastic lesions and, subsequently, with higher Olga and Olgin stages. Knowing the pH value in barely 15 seconds from the start of the procedure will enable you to perform an in-depth examination in high-risk patients by a complete mapping of targeted and appropriate biopsies, thus improving diagnostic accuracy. However, when endofaster indicates low-risk patients with a high negative predictive value, you can save both time and resources. For patients with gastroesophageal reflux syndrome treated with PPIs, endofaster verifies treatment efficacy, enabling you to either adjust dosage or change drug. Improve your diagnoses and reduce biopsies with real-time analysis. Endofaster. Real time, more life.